Welcome to this explainer on why the spinal cord stimulation trial matters. At Vertrae, a spine-only practice located right in Dayton, Ohio, every single evaluation and recommendation is built around one primary goal.
And that goal is simple: hoping patients move through their lives again without pain running the show. Now, there's a specific concept Dr. Kamal Woods often discusses with patients who are considering spinal cord stimulation. And interestingly enough, it actually isn't about the hardware. It's not even about the outcomes data. The conversation focuses on something much more fundamental to the entire patient journey.
Think about how most medical treatments work. They usually ask a patient to make a permanent, lasting decision based on other people's experiences. You know how it goes. The patient sits in the office, the doctor pulls up the research, the responder rates, the trial results, those published outcomes, and the patient really just has to take a leap of faith. They trust the doctor, they trust the evidence, and only after going through with the procedure do they finally find out the results.
But the spinal cord stimulation, or SCS trial, doesn't work that way. And that is exactly what Dr. Woods considers to be one of the most intellectually honest things spine care can possibly offer. It completely hands the evaluation power right back to the patient. It doesn't ask for a blind leap of faith. Instead, it relies entirely on lived experience.
So what does that intellectual honesty actually look like in practical terms? Well, it means testing the therapy in real life, long before any permanent commitment is ever made. Medicine rarely gives patients the opportunity to test drive a treatment beforehand, but the SCS trial is structurally totally different.
Before any patient commits to anything permanent, temporary leads are simply placed in the protected space alongside the spinal cord. The patient then goes home that exact same day wearing a small external generator, usually just clipped on a belt. And then for about a week, they just live.
They go about their actual daily life. The trial evaluates the morning commute, the nighttime routines. It tests the exact movements that normally flare up their pain, the positions they prefer to sleep in. The therapy just runs the whole time, quietly in the background. It's absolutely crucial to realize this isn't some observation in a sterile clinical setting. It's a test in the environment that actually matters, your own home.
Then, at the end of that week, the patient comes back into the office. And here is where the big shift happens. They aren't bringing clinical statistics back to the team at Vertrae. They're bringing their own personal experience. The data comes entirely from them.
The clinical conversation totally shifts to real-world, functional questions. Did the burning ease? Did the therapy hold up during those specific movements that typically provoke the worst symptoms?
Did they sleep? This is a huge one, right? Because many patients dealing with chronic nerve pain suffer from profound sleep disruption. Often, getting some actual nighttime relief is one of the very first and most significant changes noted during a trial. Restful sleep can literally be a critical turning point.
And then there's the ultimate question. Could they do something they hadn't been able to do before? Could they take a walk around the neighborhood, sit comfortably through a family meal, or drive to the store without having to constantly shift positions? In that conversation, the patient is the absolute expert. That is exactly what it means when the team at Vertrae says the trial gives the decision back to the patient.
Now, honestly, not every single trial comes back as a clean, simple yes or no. Navigating those honest answers and the clinical nuances is incredibly valuable. Real life is messy, and the result is rarely just a simple pass or fail.
Some patients experience meaningful relief right away and come back already knowing the answer. Others have partial relief, and the conversation becomes about what that actually means for them, perhaps guiding a slightly different programming strategy. And some don't respond at all. But here's the thing, even that teaches the team something vital about what is really driving the pain and what the right next step might be.
In every single case, regardless of the outcome, the trial protects the patient. It protects them from making a permanent decision without knowing the facts firsthand. And that matters immensely, because it is a patient's spine, it is a patient's life, and a decision this significant should never rest on a doctor's recommendation alone.
The whole process is deliberately sequential. It's safe and it's risk-free. It starts with just a simple conversation, moves to a temporary, fully reversible trial, and results in a confident, empowered decision. At every single step along the way, the patient retains the right to pause or reconsider, which completely removes the pressure of having to commit to surgery up front.
For anyone out there wondering whether they might be a candidate for spinal cord stimulation, that exploration starts at Vertrae without a procedure ever being scheduled. It is just an unhurried conversation with a dedicated team ready to give an honest answer about whether this makes sense for the individual.
So it leaves a critical thought to reflect on. Is this a conversation worth having, just to get back into the driver's seat of life? When a medical decision is based purely on lived experience rather than statistics, it completely changes the approach to finding relief.
Vertrae, located in Dayton, Ohio. Visit Vertrae.com or call to start the conversation today.